Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast.
On today's episode, I have some special guests for my university's undergraduate nursing research and evidence-based practice course. James Allen, Leah Begnaud, Paige Gill, and Jonathan Hernandez are joining us to discuss their evidence-based practice project. Before they get started with that discussion, though, I want to let our listeners know that I have shared a copy of this group's evidence-based practice poster to accompany this episode. You can find that resource in the show notes or the informational area of whatever podcast app you're currently listening to. Now, without further delay, let's turn the show over to Leah to get us started.
Hello, listeners. My name is Leah Begnaud, and on behalf of my group members, Paige Gill, James Allen, and Jonathan Hernandez, I'd like to welcome you to our podcast. We're all undergrad nursing students at McNeese State University in Lake Charles, Louisiana, and today we'll be discussing the work we've completed in our nursing research and evidence-based practice course. The title of our presentation is Animal-Assisted Therapy in Reducing Pain and Anxiety in Hospitalized Patients. Have you ever noticed how spending time with an animal can instantly bring comfort or reduce stress? Our research explores how that same human-animal bond is being used in healthcare settings to improve patient outcomes. In this episode, we'll take a closer look at the evidence behind animal-assisted therapy, its impact on patient well-being, and what it could mean for the future of holistic nursing care. So sit back, relax, and join us as we dive into the healing connection between humans and animals.
Thank you for introducing your team and for presenting your project topic. Animal-assisted therapy has gained growing attention as a complementary approach to supporting hospitalized patients, particularly in managing things like pain and anxiety, as your group mentioned. To help our listeners understand why your group chose to explore this area, Leah, can you begin by outlining the problem your team set out to address, and why do you feel that this topic is important for us to examine?
Elevated levels of pain and anxiety are a common complaint among hospitalized patients. These symptoms don't just make patients uncomfortable, they can slow down recovery, increase the need for pain medications, and even extend hospital stays. As nursing students, we see how distress impacts patients every day, and we know that comfort and healing go hand in hand. That's one of the reasons our group chose to explore animal-assisted interventions, or AAI, as the focus of our research project. So what exactly is animal-assisted intervention? AAI is a structured, goal-directed interaction between a patient and a trained therapy animal, such as a dog, cat, or even a horse, that takes place under the supervision of a healthcare professional. It's not just having a pet visit at the hospital. It's a therapeutic approach designed to promote physical and emotional well-being. Recent studies have shown that these interventions can lead to measurable improvements in patient outcomes. Patients who participate in AAI sessions often experience reduced pain perception and anxiety, lower heart rates and blood pressure, and an overall elevation in mood. These benefits have been documented across a variety of settings, from rehabilitation centers to intensive care units and medical surgical floors. Our group was drawn to this topic because it represents the compassionate, holistic side of nursing, one that focuses on treating the whole person, not just the disease. While modern medicine relies heavily on medications and procedures to manage pain and anxiety, these approaches don't always address the emotional or psychological distress that patients feel during hospitalization. AAI offers a non-invasive, patient-centered complement to traditional care, one that aligns perfectly with nursing values of empathy, comfort, and human connection. As future nurses, understanding and promoting interventions like AAI is important because it empowers us to provide care that supports the body and the spirit. By exploring the evidence behind animal-assisted therapy, we can help bridge the gap between science and compassion, and ultimately improve the overall patient experience.
Good discussion, Leah. This discussion highlights the very real impact that pain and anxiety can have on hospitalized patients, from slowing their recovery to increasing medications that are needed. Now, as you noted, traditional interventions do not always provide complete relief, which is why the growing interest in guided, professionally supervised animal-assisted therapy is so compelling. Early studies do show promise, and that makes for an important area for evidence-based exploration. To guide your team's investigation into this topic, you developed an evidence-based practice question. So, Paige, can you share the EBP question that your group created and how it helped to focus your research process moving forward?
Now that we've established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We've crafted our EBP question in the PICO format to include population, which is hospitalized patients, intervention, which is animal-assisted intervention, comparison, compared to standard care, and outcome, reduced pain and anxiety. Our question that guided our literature search on our project topic was, in hospitalized patients, does animal-assisted intervention compare to standard care and reduce pain and anxiety?
Thanks for sharing your group's PICO question with our listeners, Paige. This question served to focus your group's investigations into the published research literature. Can you tell us more about how you use that PICO question and its individual components to help you find research studies that are published in your selected topic area?
We used our group's PICO question to create keywords to search the following university library databases: CNOL Complete, PubMed, and Cochrane Library. Some of the keywords that we utilized for our searches included animal-assisted therapy, interventions, hospitalized patients, pain, therapy dogs, and hospitals. We set specific search limiters on our searches, including full text, peer-reviewed, date restrictions from 2020 to 2025, and quantitative research. The information gathered through these resources generated a limited amount of quality research pertaining to our PICO question. It seems animal-assisted therapy in the quantitative research space is quite restrictive in this particular subject. Our group had found many articles related to our subject, but not meet the necessary criteria we needed to fulfill our synthesis table. Systemic reviews were commonplace throughout our searches involving our subject. However, in the context of qualitative research, the information has some abundance. It seems many of the positive effects when it comes to animal-assisted therapy affects many individuals in an emotional sense through our research. Hopefully, in the near future, more quantitative data will be presented to the community, showcasing a more in-depth look at the effects of animal-assisted therapy when combined with a hospital or clinical setting. Some helpful hints when conducting our research involved using Boolean searches and search limiters to narrow down the specific information utilized in our research. These proved especially helpful due to the quantity of research articles that use many of the terms related to our PICO question.
Thanks, Jonathan. It sounds like your group encountered a wide range of study types, particularly systematic reviews and qualitative studies, even though fewer quantitative studies directly addressed your PICO question. Your use of Boolean operators and search limiters to narrow and refine the results was a strong approach, especially for a topic with such broad and diverse literature like yours. Now that the evidence had been gathered and reviewed, let's take a closer look at what the research actually showed. James, can you walk us through the key findings that your group identified?
When our group reviewed the literature on animal-assisted interventions, we found that almost every study pointed to the same conclusion. Bringing therapy dogs into the hospital setting consistently improves patients' emotional well-being. Across the board, these interactions lowered anxiety, lifted mood, and helped patients feel more connected to their caregivers. Even brief visits, just 15 or 20 minutes, made a measurable difference. The studies we reviewed varied in design, but the overall message was consistent. In one randomized trial conducted at Virginia Commonwealth University, hospitalized older adults were divided into 3 groups. One met with a therapy dog and handler, one met with the handler alone, and one received only standard care. The patients who interacted with the dog showed an immediate improvement in mood and a clear drop in anxiety after their sessions. Those changes didn't last long after discharge, but during the hospital stay, the effects were significant. Patients felt calmer, more cooperative, and more motivated to take part in their recovery. It really showed how powerful even short-term emotional relief can be in a clinical environment that's often stressful and unfamiliar. A European clinical recovery study published the following year found almost the same thing, but focused on rehabilitation units. In that trial, patients participating in structured dog therapy sessions not only reported lower pain levels, but also a higher quality of life score than those in the control group. Nurses involved in that program said that patients looked forward to the therapy dog visits and seemed more willing to engage in physical therapy afterward. So, the benefits went beyond mood, they actually helped patients participate in their own care. A broader systemics review published in 2025 summarized multiple hospital-based studies from different countries. It concluded that animal-assisted programs consistently reduced anxiety and improved emotional stability for patients across a wide range of diagnoses and settings. The review also highlighted that safety and infection control protocols were well managed in these programs, which helps counter one of the main concerns hospitals have about bringing animals into clinical spaces. Smaller pilot studies provided even more support. One project involving older adults in acute care units found improved social interaction and a stronger sense of connection with staff after therapy dog sessions. And among veterans struggling with post-traumatic stress, structured animal-assisted sessions helped reduce tension and promote emotional regulation, especially when combined with standard counseling and support groups. When you step back and look at all of these studies together, the evidence paints a pretty consistent picture. Animal-assisted interventions deliver clear, short-term psychological benefits, particularly reductions in anxiety and improvements in mood. They also enhance patient engagement and satisfaction, making hospital stays a less sterile and a lot more human. Importantly, every successful program we reviewed emphasized the need for trained handlers, certified therapy animals, and nurse oversight to ensure safety and infection control compliance. Overall, the collective research supports animal-assisted intervention as a safe, low-cost, and holistic addition to nursing care. It doesn't replace medication or counseling, but it complements them beautifully by addressing the emotional side of healing. By helping patients relax, smile, and connect, these programs create a more compassionate care environment, and that in itself supports better patient outcomes.
Thank you for summarizing those findings so clearly, James. The consistent reductions in anxiety, depression, and pain, as well as improvements in mood, motivation, and overall well-being, really highlight the therapeutic potential of these interventions. Your description of structured therapy dog sessions, facilitated by trained handlers and supported by nursing staff, also underscores how intentional and collaborative these programs have to be. The increased patient engagement and social interaction you noted suggests that animal-assisted therapy may play a meaningful role in supporting recovery across various inpatient and rehabilitative settings. With those results in mind, it's important to consider how this evidence translates into the day-to-day nursing care. So, James, can you share the nursing practice implications that your group members identified?
The overall research supports animal-assisted intervention as a meaningful, evidence-based addition to the nursing practice. When these programs are implemented correctly, short therapy dog visits can noticeably reduce anxiety, improve mood, and help patients feel more comfortable and engaged in their recovery. For nurses, this offers a practical, low-cost way to support emotional well-being alongside medical care. However, incorporating these programs safely requires structure and collaboration. Nurses should work closely with certified therapy dog teams and infection control personnel to ensure that each visit meets hospital policy and patient safety standards. Animals must be healthy, well-groomed, and temperament tested, and handlers need to follow established hygiene procedures such as hand washing and avoiding contact with open wounds or isolation patients. These precautions maintain safety while allowing patients to benefit from the interaction. When managed responsibly, animal-assisted intervention aligns perfectly with nursing's holistic approach to care. It recognizes that comfort, trust, and emotional stability are a part of the healing process. Whether used in medical surgical units, rehabilitation, or palliative care, these programs give nurses another tool to support patient satisfaction and overall quality of life. With thoughtful implementation and ongoing evaluation, animal-assisted intervention can strengthen the human connection that defines effective nursing practice.
Good job outlining those practice implications. Your points highlight how animal-assisted interventions can serve as valuable complementary strategies across hospital, rehabilitative, and palliative care settings. It helps us with supporting mood, easing anxiety, and enhancing patients' overall comfort levels. Your emphasis on using consistent outcome measures to evaluate patient responses is especially important for ensuring these interventions remain individualized and evidence-driven. Advocating for more integration of this into institutional policies also demonstrates how nurses can help shape a more holistic approach to patient care. Building on these clinical considerations, your group also explored where additional research is needed. Jonathan, can you walk us through the research implications that your team members identified?
There are still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research. Due to the limited quantitative information available regarding animal-assisted therapy, the data produced and implemented on our table had small sample sizes in almost every article. The most involved in an experiment was no more than 300 subjects. Another gap observed in our research involved research that pertained to qualitative studies. Many articles were seen which utilized rating scales on how animals change their mood and calm those with severe anxiety. It is safe to say any experiment would be beneficial when utilizing a qualitative approach while gathering different forms of quantitative data. The last implication for research would be the involvement of logistics. Funding toward these programs can be quite substantial. Every step in the logistical chain must be considered when implementing therapy programs using animals. From feeding, housing, and insurance regarding these animals could place a heavy strain on any healthcare network.
Thank you for highlighting those research needs, Jonathan. As you noted, while early findings are promising, the current evidence base remains relatively limited and often inconclusive. More rigorous studies, particularly those examining how animal-assisted therapy can be implemented across different clinical settings, will be essential for strengthening future practice and policy recommendations. Now, to bring all of this together, Paige will now share your group's overall conclusions. Paige, what final insights would you like to leave with our listeners?
After reviewing all of our research studies related to evidence-based practice question, our group was able to confidently determine that animal-assisted therapy has a strong positive impact on hospitalized patients. Across multiple studies, the results showed that interacting with therapy animals can significantly lower stress, decrease anxiety and depression, and overall improve mood and comfort levels during hospitalization. Patients who participated in animal-assisted therapy often describe feeling more calmer, more motivated, and more emotionally supported during their recovery process. Some studies even noted measurable physical improvements such as reduced blood pressure, decreased perception of pain, and higher quality of life scores. Altogether, the research demonstrates that animal-assisted therapy is a valuable complement to traditional hospital care and can play an important role in promoting holistic healing and patient satisfaction. Working on this project really opened our eyes to how meaningful evidence-based practice is in nursing. It is one thing to hear about EBP in class, but it's another to actually dive into research articles, analyze data, and see how evidence can directly shape the care that we provide. We realize that every nursing intervention, big or small, should have the evidence to support it, because what we truly do is affecting patients' outcomes. Through this process, we learn how to critically appraise research, compare findings across studies, and translate data into real-world nursing practice. Another big takeaway was understanding the importance of keeping up with current research. Healthcare is constantly changing and evolving with new discoveries for tomorrow. As future registered nurses, it is our responsibility to stay informed, question our routines, and make sure providing care that is backed by the latest evidence. By incorporating evidence-based interventions like animal-assisted therapy, we can help improve not just physical health of our patients, but also emotional and physical well-being. Ultimately, this project didn't just teach us about animal-assisted therapy. It taught us about how to think like professional nurses. We learned to connect research with patient care, to rely on sciences as the foundation for compassion, and to see how evidence-based practice elevates the entire profession. In our future nursing careers, we will carry these lessons with us, continuing to learn, to question, and to care, with both heart and evidence guiding every decision we make.
Thank you for summarizing your group's conclusions so thoroughly, Paige. The evidence you reviewed offers encouraging support for animal-assisted interventions as a way of reducing pain and anxiety in hospitalized patients, particularly when compared to standard care alone. At the same time, your group wisely noted the need for additional research to clarify long-term effects and to determine which intervention protocols are most effective across different patient populations and care settings. One of the most meaningful takeaways from your project is the reminder that evidence-based practice is foundational to nursing. Whether an intervention is complex or seemingly simple, it should be grounded in research that supports its effectiveness and guides our clinical decisions. That commitment to evidence strengthens the care nurses provide while elevating outcomes for the patients that we serve. To our listeners, thank you so much for joining us on today's episode. Exploring innovative, patient-centered interventions like animal-assisted therapy, it challenges us to think beyond traditional approaches, the way things have always been done, while remaining open to emerging evidence. We hope that you'll join us again for future discussions on nursing research tips.